Hello, testing. Okay, sounds like we're working now. Okay, Chris, let me know if you can hear me now. It sounds like we are back on. Okay, here we go. All right. Sorry about that, guys. I don't know why, but I'm having a little bit of an audio issue, so hopefully you can hear me now. Welcome. This stream is going to be a little bit different. All right, good to hear. Thank you for letting me know, guys, Marina and Chris. That's very helpful. So this is going to be the last stream. Maybe if you have Instagram and follow the Core Balance Training channel, we made a post yesterday announcing that I'm going to be going on my honeymoon, and so I'm hopping on a plane tonight, and I'll be in Costa Rica for the next 6 weeks. And if you haven't noticed, I'm in a little bit of a different environment right now. So I'm a little closer to the Los Angeles airport, and so yeah, gonna stream today and answer a bunch of questions, and we're gonna be talking about the mind-body connection. And then next time you see me, will be in I'll be streaming from Costa Rica. I'm not 100% sure I'll be able to do it live, but I'm planning to. I'm bringing my microphone here, and so I'll do my best to continue the streams every week, and we'll see how the internet is there. But it's going to be an extended honeymoon. My wife is a teacher. Lovely Marina, she posted in the chat there, so thank you for the support, Marina. And so she gets summers off, and we're gonna take advantage and go celebrate our new marriage together and do lots of surfing. So thank you, Chris. I appreciate that, and thank you for being here as well. We were in communication a little bit this week. I don't know if I have your question in the lineup for today, Chris, because I think I responded to it, just a written response. But if you have any follow-up questions about that topic, feel free to post in the chat. And anyone else who's here, feel free to post in the chat. Let me know that you're here, where you're coming from, and thank you for being here. I didn't really announce this live stream with an email this time. It's just been really busy getting ready for the trip, so I don't expect a lot of people to show up. But if you're watching the replay, I hope you enjoy it, and you can post in the comments down below the video. All right, Patricio, good to see you. Thank you for being here. So let's get into it. We're going to get into the topic. I kind of skipped my normal intro where I say, welcome to another episode of Without Pain Wednesday. And my name is Dr. Ryan Peebles. If you don't know me already, I've dedicated the last 20 years of my life to better understanding and reversing the root causes of chronic lower back pain. And so I've kind of distilled everything I've learned down into the Core Balance Training program. And really what it comes down to is learning how to use and move your body in a healthier way. And a lot of that comes down to using your core more in your daily movements, and connecting more with your core and making it more active in your daily life. Not through doing sit-ups and getting it stronger and getting a six-pack abs, but connecting with the deeper muscles so that when you reach into the cupboard to grab a glass, that your core is supporting your spine. And so that's what this is all about. And this is a weekly live stream. I show up every week to answer questions and support the core balance training students. So if you're here and you're a student, thank you. I'm super grateful, and I'm just blown away by the gratitude that has been shown back to me lately. So thank you all for that. And if you're not a student and you're just curious about the program and somehow you found this stream, you feel free to ask questions as well, and I hope this gives you a little more insight. Hello, Guillermo, and thank you for being here. Good to see you again. I love that you're becoming one of the core live attendees, and that's hard to do. This is a rough time for a lot of people. It's 12 o'clock on the Pacific coast here and 3 o'clock on the East Coast. I know those are working hours, but we'll do our best to improve the timing of this when we can. So I'm going to introduce the topic. The topic is actually something that was brought to me last week by a student, and so I'm going to go ahead and read the email that he wrote to me, and we'll start with that. So I see a little glitch here. Let's see, is this not right? And this is not right. Is that better? That looks better. All right. So this is from Adam. I forgot to write his name down, but Adam wrote me this wonderful email, and I'm going to read it so you don't feel like you need to read along. I know there's a lot of words here, but you can just listen, and this is going to be this is what kind of generated the topic for this week. So it says, Dr. Peebles, I am now in Module 5 of your program and seem to be getting a lot out of it, though the pain in my left glute lower back is still present. I found the book Healing Back Pain by Dr. John Sarno in your reading suggestions. By the way, if you haven't already, check out my book recommendations in the resources library in the program. There's some other books in there too that I recommend, and they could be really helpful. So he says, and I've spent the last 2 to 3 weeks reading his mind-body prescription book and researching TMS. I am very curious what your thoughts are on his teachings/treatment and what your advice would be for navigating between physical healing and emotional/psychological healing. So we have kind of two different schools of thought here. And so we'll talk more about that. We have the emotional, the psychological, and then we have the physical causes of back pain and also healing of back pain. There seems to be a lot of evidence for both approaches, but the two sides don't address each other. Dr. Sarno suggests that chronic back pain is directly the result of repressed emotions and will be unaffected by physical therapy such as your core balance program. Yet, your program makes more sense to me than any other physical healing method due to its emphasis on fixing posture, re-engaging the core long-term, and physical intentions in all movement throughout the day. Thank you so much for your help and inspiration. Thank you, Adam. I really appreciate your email. As I mentioned in my response, I think it's a fantastic email, and you've obviously been doing your research, and I honor you for that. That is how I got to where I am, is just mostly doing self-research. And a lot of that happened before I ever went to physical therapy school. And after so many years of empowering myself through research and reading and different things, I finally thought, wow, it's probably time for me to get some sort of credential in this because I already know so much. And so maybe that's a path for you, Adam. I don't know. I have no idea where you're at in your life, but if you're putting in the work and the effort to empower yourself like this, is a really wonderful thing. So honoring you for that. So let's talk a little bit about this. We have Dr. John Sarno and this book, which I recommend in the program as a recommended reading. And I mentioned that reading this book, I was probably about 24 or something. So I'm 36 now. Maybe I was younger. I imagine I was a little younger than that, but it changed my life. It was a pivotal book for me to read and to learn the things that he was saying that I had never heard anything like this before. And if you haven't read it, then he kind of gives the overview in his message to me. Adam does, in that, you know, it's emotional and psychological causes that are causing back pain, and they have and the back pain, the pain has nothing to do with physical causes. And so he basically explains how this works, in that emotional stress can cause tension in the body, and the tension that it causes restricts blood flow. The blood vessels constrict because they tense up, and in that physiological response, there is less blood flow to the tissues. And because there's less blood flow, there's less oxygen, and the muscles are basically starving of oxygen, and that causes pain. And so that's Dr. John Sarno's explanation for most cases of back pain. And I think it's a good thing to know. I think it's an element, it's a factor in back pain. And then there is the other universe, the other school of thought, which we learn about in physical therapy school or any other kind of, you know, Western medical school or training program, is going to be more focused on the physical, in that there's something wrong. You know, Western medicine seems to use they place a lot of emphasis on disease. So degenerative discs are actually a disease, and that this must be treated with medicine or exercise. And so, but it's a physical thing. Okay, there is something physical happening. It might be related to posture or genetics or trauma or a different physical cause that you might be able to think of. So the question I see here is, and I'm going to go back to a more bigger screen here, is, do these two schools of thought overlap, or are they separate? Which is what Adam has said, is that I'll read what he says, is that there seems to be a lot of evidence for both approaches, but the two sides don't address each other. Okay, so are they separate? Do they not relate? And it is my personal belief, I wanted to address this live because I think it's extremely valuable. I think that they absolutely overlap. And I think that there is a cause of back pain that is psychological and emotional. And I think Dr. John Sarno is right that tension causes back pain, and emotional, different mindsets, different psychological states of being cause tension. I believe that there is a mind-body connection, in that thoughts that you have and emotions that you feel in your mind have a physical effect on the body. And I would hope that most people believe that. So there is a connection, and that connection can cause back pain. And also, I think that back pain can be caused by physical causes. And I would hope that Dr. John Sarno would agree with that, because we all know people who have been in a car accident, and that's when their back pain started. And you could argue that the ongoing persistent back pain might be continuing because of mental causes. But I believe that there are other physical causes beyond an acute trauma, such as a car accident. I believe that posture and muscle imbalances, what I teach in the masterclass, can lead to joints being out of alignment. And so if joints are out of alignment, if there's a little bit of they're not congruent with each other and they're moving, that causes friction, and that's the basis for the degeneration. And so I believe that, like I said, both can contribute, and I believe that in some cases, people will have both impacts simultaneously. So maybe the back pain started with a car accident or started after years of muscle imbalances and poor posture, but that back pain has caused some emotional situations that make it harder to get out of back pain, and the emotional and psychological state of mind could be causing the back pain to be ongoing. And the reverse can also be true. I think that emotional and psychological states of mind can be the original cause of back pain. And maybe if it goes on long enough, that those problems can become physical, and that the muscles have been starving of oxygen for so long that they're not working properly, and that can cause dysfunction in the way we move. It changes the way you move in your level of confidence. It can cause fear in the way you move, and that itself can become a self-perpetuating cycle and cause physical damage. And so that's how I would like to approach this. So this question is, do they overlap? Absolutely. Is Dr. John Sarno right? Is all back pain emotional and psychological, and so whatever you do physically won't affect it? I don't agree with that. I don't think he is saying that. I think in his book he's saying that a large percentage of cases of back pain might be this way. And maybe it's possible that his estimate for the amount of back pain cases that are purely emotional and psychological might be a little larger than what I would believe, but I do believe that some are emotional. And I think that some are purely physical, but I don't think his solution is the end-all be-all, and I don't think only treating the physical is the end-all be-all. I think maybe in a lot of cases you need to address both. And so the question is how to do that. Well, the physical is spelled out in my program, so my answer to how to address the physical is it would take me hours, it would take me weeks to answer that. But as I said in the beginning of the stream, I believe a lot of it has to do with making your core more part of your daily life, and reactivating it, and just having an awareness that that's what supports your spine in your movement. I think that our lifestyle, back pain cases are generally going up. I think it would be like this for you guys. So generally the numbers of back pain, the percentage of people experiencing back pain is going up. And I believe that is related to lifestyle, the amount that we spend sitting, the amount of time that we spend at a computer or in front of a screen. And also, mental illness is on the climb as well, for many different reasons. So you could argue that that could be another reason why back pain numbers are going up. So at the end of the day, I believe that both should be addressed. I'm not a specialist in psychology or, um, addressing emotional pain, but I do believe that it's healthy to express your emotions, even if they're negative. And I believe that holding things in and bottling things up can lead to a physical manifestation of emotions. And so that's exactly what Dr. John Sarno is saying, is that it's a physical manifestation of emotional energy, because it's not being let out through through communication or emotional expression. So it needs to be let out somehow, and that's how it basically transmutates into a physical symptom, which is tension, muscle tension. So that's the extent of where I would go, not being a professional, and I think that that's not the only solution in most cases of back pain. And it's good to be aware of. So the book is, I still recommend it because it's a valuable awareness to have. And I believe that, and having had thousands of conversations with real humans in back pain and seeing hundreds of imaging, that there is a physical component in the majority of cases of back pain. And that's why, in my journey, I was not trying to reach this destination of where I'm at now. I was on a journey looking for answers, and my answers were ended up being this. And so that's why this program is more physically focused, and it has been highly successful in helping people. So that's really the extent. I'm hoping that this stream's going well. I don't know if there's any connection issues on this new internet that I'm on. It's a different internet. So we'll get into a question in the chat, and then we'll get into some student questions that I came prepared with. And that's really what I wanted to say about the topic. So thanks again for your email, Adam, and for bringing this up. I think it's an important topic for people to just be aware of, and that there is a mind-body connection, and maybe that doing some emotional healing could help speed along anyone's journey out of back pain. All right, so the question in the chat was from Patricio. What do you think about the book The Way Out by Dr. Alan Gordon? I have not read this book, Patricio, but what I will do is put this on my list. I'm copying and pasting it right now into my notes, and I might give this book a read. So thank you for the recommendation, Patricio. Have you read the book, and what do you think about it? I'm curious to know if you're still here, Patricio. What were your takeaways from that book, and do you recommend it? And all right. So let's get into some student questions. Switch screens here. And go to, this actually isn't a question as much as it is a comment from a student that I wanted to address. So this is from Kaylee, and I believe she's talking about the perfect bridge, the main exercise that we learn in the first week. Okay, Patricia, I see that you're starting to read the book. Okay. Do you have any thoughts so far? Do you have you got far enough to form an opinion yet? Or is it just too early to tell? Okay, so Kaylee says, with the bridge, I lose the abdominal connection if I go higher in a bridge. I also think this bed I have, she's renting a furnished place, is some kind of memory foam or Tempur-Pedic, is causing a lot more issues. I wake up feeling like I got hit by a bus sometimes. So I wanted to address that, and then the paragraph below is a separate comment and a separate lesson, so we'll talk about that next. But this one here is kind of two different things. First of all, feeling like you got hit by a bus when you wake up is no way to start the day. So I'm sorry to hear that, Kaylee. I would definitely look into other options for a mattress. Mattresses can have that effect. So if it's way too soft for you, that could make your body really sore when you wake up. And if you can borrow a mattress or sleep on the floor, you might feel a lot better waking up, or even just a sleeping pad. Like, just find some other form of a pad or maybe a blow up mattress or something so that you don't have to start your day like that. Yes, a mattress can have that effect. Firmer is generally better, especially if you sleep on your back. The firmer the better. If you sleep on your side, you can go a little softer, and that's a little better for your shoulder that you're sleeping on, whichever side. And then the first sentence, you lose abdominal connection if you go higher in the bridge. That is very common, Kaylee, and that's actually one of the things that you are working on progressing. That's one of the goals, is to be able to maintain connection and be able to come up higher in the bridge. That is a sign of progress, and you're trying to make that progress over a period of days or even weeks. And so the fact that you can't do that now is not a bad thing. It's just where you're at now, and your goal is to get better. And it doesn't happen overnight. You can make a little bit of progress each day, but your goal is in the big picture to make progress over a longer period of time. And that kind of progress, that slow progress, is the way it happens. And so it's okay where you're at now, and I just encourage you to continue practicing and have that long-term big picture mindset that it's going to take days, if not weeks, to be able to maintain connection and come up into full bridge, based on where you're at now. So it's okay, and keep going. I see Patricia. We'll go back to the chat here. So it's about a similar mindset, body approach. Okay, so similar to Dr. John Sarno, and it's too early to give your opinion, but you heard amazing things about it, which is probably why you're reading it. So yeah, cool. I'm glad you're investing in yourself too, and it's never a bad thing. Even if the book isn't something you agree with, it offers you a perspective that can help you form your own opinion and grow, and maybe find another source that's more in alignment. Yeah, honoring you for that. Okay, so Kaylee, in a separate comment, I remember she posted this in the Module 1 assessment, so the very end of Module 1. It says, I am able to activate the core muscles when I sit and breathe, and when I lay down before a bridge. Okay, great. It takes a ton of effort to maintain in a bridge. I found it helpful when I let go and re-engage them while in a bridge. But again, I'm not lasting super long, and I feel a ton of tension in my neck and upper body. I lose some core connection in a bridge unless I really, really concentrate or let go and re-engage. My sides are sore too, and I feel tight, and so do my hips. The concept I struggle most is the push away. Most with is the push away. Okay, Kaylee, so it's kind of similar to what I was saying before. I think where you're at is I wouldn't have put the pressure on yourself or have the expectations that you should be able to come up into full bridge and maintain connection. The best thing that you can do is work where you're at and try to make incremental amounts of progress over time. And that's the best possible thing you can do. There's no better thing you can do. Making a massive amount of progress in a short period of time for the body is extremely challenging. The body doesn't like rapid change. And so be okay that where you're at now is okay and it's normal. And so to maybe just turn down the intensity a little bit on your training, and I don't recommend having to try as hard as you can to do this stuff. In the beginning, this is more meditative and tuning in and mental, mind-body connection, being able to feel your body. And I actually want to give you credit for the amount of body awareness that you are showing in your comments. I think it's impressive that you're aware when you lose connection, and just the amount of description about where you're feeling tension and where you're not feeling tension. And so keep that up. That's really helpful for the whole program. And so I just wanted to honor you for that. And so I think that's my advice is take a little pressure off yourself to be able to do this fully, and just practice where you're at, turn down the intensity, breathe, and be able to relax at the same time so that you're not tensing your whole body and causing extra tension in your neck and your shoulders and your upper back. That is a common thing that happen to students when they're trying really hard, because when you try so hard, you just tense your whole body. And what we're trying to do is hyper focus our attention and our muscle engagement into the core. And so it really helps to just turn things down and operate at a little bit of a lower intensity. There's actually going to be a lesson on that in 2 days for you if you're on day 7 right now. So in a couple of days, you'll get a lesson on turning down the intensity, and that's it seems counterintuitive, but it's going to be a key to making progress in this program. And the soreness you're feeling, I would expect, is from just tensing so much. So I think your soreness will go down as if you turn down your level of effort and intensity. It's a really common thing. It's a really common issue students have, and that's why there's an entire lesson dedicated to turning down the intensity, because it seems wrong. It seems counterintuitive. We want to try harder to accomplish more, but in doing that, it activates all the muscles that we don't want to turn on. And so you'll learn more in the lesson. So I see one in the chat coming through from Guillermo. So let's check this out. All right, Guillermo, this is just an update, it sounds like. Restarting the program on June 13th, and that was 2 days ago. I'm working on improving breathing and incorporating the back anchor progression. Okay, that's great, Guillermo. I think that's it really is, I think, one of the most beneficial exercises in all of phase 1 is the back anchor progression. So I'm really glad you chose that one on your own and you found that one to be where you're at, and so many people can benefit from that. So keep working on that one, and prioritize your breathing. Okay, so if you're sacrificing breathing to be able to push away harder to elevate your pelvis more, I want you to reverse that. I want you to prioritize breathing so that you can continually breathe and then add in the abdominal engagement while being able to maintain a fluid level of breathing. And so I know that means slower progress, but it means building the strongest foundation, which is breathing. Breathing is the foundation of the anchors. And the anchors are the foundation of the program, but you have to be able to breathe with the anchors. And so the breathing is the foundation of the foundation. I said that on last week's stream as well, and I feel strongly about that. So prioritize breathing, and it may take longer, but you're on a long journey, Guillermo. And I know you had to pause for a little bit, and you're just getting back to it. So there's no pressure to be able to progress really fast. It's better off that you just do this right. And like I said, I'm really glad you're on the back anchor progression and you're really focused on your breathing and you're aware that's something that's a factor. So keep doing that and be patient with the progress, because it will absolutely come. That reminds me that Kaylee had mentioned in her question the push away. When I said push away to you, Guillermo. So she says, the concept I struggle with most is the push away. Kaylee, I'm going to be answering a question about the push away and later on. I have lined up in the queue here. So if you keep watching, or you can click ahead to a couple questions. Let me see which question it is. Not that one. Not that one. One of these. Okay, this question here. That's wrong. So it's the last question, Kaylee. So I'll come back to this, but the last question is going to be on the push away. So if you use the chapters and down below to skip ahead to the last question, I'll talk more in depth about the push away. All right, so next question is from Jack. This is a question about the typewriter squat, and he says, this is similar to horse stance, correct? I feel some imbalance between right and left. Should I focus on shifting to the weak side until balanced? Absolutely, Jack. You are right about that. So to answer your second question there, whenever there's an imbalance between left and right, and this is later in the program, I believe Typewriter Squat is phase 3. So he's pretty far along in the program. He's in the 3rd month. And in phase 3, we address left to right imbalances. I'm going to talk more about this in a later question, but before we can address left to right imbalances, we address front to back imbalances, and it must be that way. And so now he's made it through. He's gotten sagittal plane balance, and we're working on left to right imbalances. And anytime, Jack, that you feel one side weaker than the other, then you should work on the weak side and try and bring that up so that it's balanced with the strong side. And the goal is to strive for balance. So yes to that. And then I would, and this is common actually with the typewriter squat. So even myself, I can feel a slight difference between left and right. And so I just wanted to let you know it's actually pretty common. And I'm going to look up horse stance. I think it's an exercise. I'm wondering if it's an exercise. I know that you are a physical therapist, Jack, so I'm guessing it's an exercise. And so it doesn't, to me, look the same. It's similar, yes. but it doesn't look the same because they have their feet turned out quite a bit more. Let's see if I can play this.
Getting into the position.
Okay.
So here's the key points to the horse stance. We're going to take a stance that's about double shoulder width apart. You're going to need to figure out on your own exactly the width, but that's a general guideline to follow. Okay? Make sure the feet face forward. This is important. The feet face forward and the arch is always established.
So with the feet facing forward, that is how the typewriter squat is too. So that is a similarity. So we'll keep going.
You want to see the arch collapsing inwards. Always a nice and lifted arch. Okay? So we'll stand about double shoulder width apart. Now from this beginning, what I want you to think about is creating rotation inside the hip joint. So I'm actively trying to make my knees point outwards. Okay? Next.
So that's a difference. So in horse stance, he's saying to push both your knees outwards, and it seems like he's doing it quite intensely to push them out as far as possible. And we're not really focused on that in the typewriter squat, but I'm wondering if he's going to shift back and forth like we do in the typewriter squat. So I'm going to skip ahead here. So he's just going down.
Pulling mobility and strength, travel, comment and subscribe.
Okay, so basically, Jack, it's not the same as horse stance. There's a similar. The only similarity is really that it's a wide stance and that you drop down low in the stance. You drop your butt down low. But the effect of the two exercises is quite different because what we're doing with the typewriter squat is we're training, and in everything in core balance training, you're staying connected to your anchors. So we're really training the core to stay stable while being able to rotate in the hips. So one hip is doing a little bit of internal rotation and the other hip is doing a little external rotation as you typewriter over to one side. And so, and if you're not this far yet in the program and you're watching this, the typewriter squat is shifting from one side to the other with your hips. And and the emphasis, Jack, is really on the butt and the hips shifting over. So it's not the knees that we're shifting. And so if you watch, I haven't seen you doing it, but if you watch the video again in the lesson, I'm really just trying to get my butt over my heel on one side and then back to the other side. And I do see one of the most common errors with that exercise is people are shifting more their entire legs, and the knees go with them. And so just a reminder of that. So we'll move on. So yeah, not really the same, but yeah, there's just the wide stance and dropping low is the similarity, and then the movement of the typewriter squat is kind of like in addition to the horse stance. The most similar thing to the typewriter squat is called a Cossack squat. Is really similar. Is almost the same thing. You can look that up if you want. All right, we're going into the next question here. Thanks for letting me know, Marina. I figured that you probably couldn't hear the video, and sorry about that. So, next question. This is actually not from a student. This is from a prospective student, so somebody that's curious about the program, emailed and said, I've had 3 back surgeries, no fusions. I suffer from neuropathy type symptoms across my buttock, also from the bottom of my feet up to my knees. Do you think your system would improve these conditions? Thank you in advance, Mike. You're welcome, Mike. Thank you for thanking me. I absolutely believe that the program helps people who have had a history of back surgery. One of the things about back surgery is I think that people who go into the surgery see it as a solution. And I don't see back surgery as a solution. I see back surgery as the removal of or the correction or removal of a serious problem. So if you haven't had a fusion, I'm guessing your back surgeries might be microdiscectomy, where they cut out a piece of your disc that might be pressing on the nerve. And so the removal of that part of the disc pressing on the nerve is a fantastic thing because it can help you function. But the real solution has to still happen after the surgery, because whatever it was that caused that problem in the first place, the disc to, or whatever the problem was that the surgery corrected, that problem is still there, the root of the problem. And so whether someone has had back surgery or not, the program will help. But I believe that the program is really particularly helpful for people with who've had a history of back surgery, because the program is more effective for severe back conditions. And I say that because it's had more success with people like that because of where they're coming from. The program is very gentle, and it starts gentle, and so it attracts people that are not able to do a lot with their bodies. And it doesn't really attract highly athletic people very often because maybe it's like too boring or too slow for extremely fit people. But we do have our fair share of those people, but it does certainly do attract more people with more of a severe condition. And a lot of those people have had back surgery. So it's an excellent post-op program, like right after back surgery, or even if it's just in the distant past. What the program does, Mike, is it helps you to build up the deep spinal support muscles, the deep core stabilizers to support your spine so that they act like a back brace, and without wearing a back brace. And it starts off very low intensity, and it gradually builds up over a period of, if you go through the whole program, it's about 12 weeks. And so we do get to higher intensity things like what I was just talking about before, the Typewriter Squat. But yeah, and with the neuropathy stuff, it'll just depend on how long that's been going on. If it's been going on for 10 years, maybe we can curb it from continuing to get worse, and maybe you can have some improvement, but it's not as likely to improve as for someone who the neuropathy has only been going on for a few weeks. So that's the truth. And so that's the only factor, is the amount of time that the neuropathy has been going on. And but either way, if it's been going on for 10 years, it can, a solution, a real solution, can help it to prevent it from getting worse and maybe have a little bit of improvement. So just want to let you know that. Thank you for your question, Mike, and I hope that helps. Next question is from a student. Are we looking? Looks okay. All right, so this one's from Marcy. Marcy says, my physical therapist told me your butt should be beneath you, not behind you. I like that. I've never heard that, but yeah, I mean, it makes sense. I believe this is in line with what we are learning here, correct? I walked 5 miles today and could feel it in hip flexors since I was conscious of my front and back anchors. I'm wondering if the anterior pelvic tilt can eventually cause medial knee problems. My knees are feeling better since I started the program. Thank you for all you are doing, Marcy. Marcy, you're not the first person, and you probably won't be the last person to tell me that your knees got better from doing a back pain program, doing core balance training, particularly core balance training, and absolutely 100%. The tilt of the pelvis and all, the tilt of the pelvis is a result of muscle imbalances. The muscles are what pull it into the tilt, and those same muscles, some of them, attach directly to the knee and have a direct, not even indirect, but like direct impact on the alignment and function of the knee. And so I'm not surprised, and I'm very happy to hear that your knees are feeling better. And yes, this is very interrelated. So keep at it. You're doing great. I know you've been a really active student, and so proud of you for that, and keep going. Let's talk about the top one. So your butt should be beneath you, not behind you. I like that partly because it's funny, and also because it's addressing the anterior pelvic tilt that we address in the program. So an anteriorly tilted pelvis would mean that the butt is more, stink bug sticking back like that. But I don't think it's the full story because, you can't, a lot of people, what they would do to get their butt underneath them is to squeeze their glutes. And you can't function in life with your glutes squeezed all the time. You can't walk with your butt squeezed just to get it underneath you. And so the full story is that, yes, your pelvis should be in neutral, but it's not just your butt. It's your core and all the surrounding muscles. If you imagine the visuals in the masterclass where the muscles are pulling the pelvis, it's lots of muscles on all sides of the pelvis that are pulling it. And so all those muscles being in balance is what keep your pelvis in a neutral position, not just your butt. So, but I do like it, and I do agree with it, and it's funny too. And nice job walking 5 miles. That is awesome. I, as you know, fully sport walking. I want everybody to walk more, and it's hard to do because it takes time. But that's something to really be proud of. So keep at it. And if your hip flexors are firing too much when you're walking, just turn it down a little bit, relax a little bit, and see if you could just incorporate the anchors a little more fluidly into your walking rather than holding and like gripping the anchors. So hope that helps. We got 2 more questions here, and we're already at a full hour, so that's quite impressive. Let's get to one from Heidi. Heidi says, I went for a walk today. Good job, Heidi. We got a theme here going. Walking is good. And Heidi's another great active student. So, always honoring her. So she says, which is normal practice for me. I try to do a 3-mile walk. We have a great trail to use on our property, so I really tried to apply the anchor triad. It certainly helped. I'm assuming I would apply the same principle when I'm going uphill. I try not to lean too much forward as that can dump into my lower back. Try to use my quads and glutes a bit more. So Heidi, I know that, so you asked this question about how we should apply the anchors going uphill, and then the very next day, the lesson was on walking uphill and downhill with the core anchors. So I know you already got your question answered, but I just wanted to address this. And I know you did that lesson because you posted in the lesson that it made a lot of sense to you, and I hope it worked for you in practice. I just wanted to say that, what did I want to say? So, so leaning forward is going to dump into your lower back, And so the healthy thing that we want to do is the hip hinge. And so that's what that walking uphill lesson is all about. We're going to hinge instead of lean, with causing some bending in the spine. And so that's a lot less stress on the back. And so, yeah, I hope you already got your question answered in the lesson. Chris, something coming through in the chat, so we'll go back to the chat real quick. Chris, it says, Dr. Ryan, your program has really helped me become more connected with my body, specifically noticing muscle imbalances. I've noticed that I have slightly more muscle in my left leg compared to my right, specifically in my quads. What are your thoughts about strength training to address the imbalance? This is a really good question and super relevant, Chris. So this is something that I've dealt with in the past. It was my right quad that was bigger than my left. I had a traumatic injury to my left quad in the form of a gunshot wound, which we can talk about more in another stream. But my left quad was always smaller than my right, and it caused problems. It really, it had an impact on my pelvic positioning and everything. So you do want to try and even out the strength in those two sides, the left and the right. And so that is something that we do later in phase 3 of the program. We start to address left-right imbalances. I think we actually start at the end of phase 2. Module 8 is where we really start, I think. Can't be sure about that, but I think it's where we start addressing left to right imbalances. And we're going to get into some like the typewriter squat, which was an earlier question. It really addresses that well. And one of the most effective things that you can do, Chris, that is not in the program at all, it's too advanced, is a single leg squat. And I wouldn't just start out doing that. And I don't know about your fitness level, but one of the things I did for my training to correct that imbalance was I started out sitting in a chair, and it can be a high chair or a tall stool, and just standing up from the chair on one leg. So it's like a single leg sit to stand squat. So you have the chair there as kind of a safety net, and you can start training that weak side. And the strength, it comes fast. And if you keep training on a single leg squat and stay connected to your core, of course, throughout, that's a prerequisite. And you keep progressing and lowering the height of the chair, eventually you can do a full single leg squat, and it's pretty awesome. I can't do one right now, but not too long ago I could do one. And if I were to start training that right now, I could probably do it again not too long from now. So that's one good way to do that. Left-right imbalances are best trained doing unilateral exercise. So that means not bilateral is symmetrical. Unilateral will be doing something different on one side versus the other. And so we do the single leg bridge in the program. We do the single leg RDL, Romanian deadlift, or I call it running man. And so all of these are going to be training the left to right imbalances. I'm going to want you to pay attention, just like you already are, to the differences in strength between the left and the right, and train the weak side more. But one way to really jump ahead with that kind of strength building in your quads is the single leg squat, for sure. And I don't know if your fitness level is appropriate for that, but if it is, I'd try it. And if not, then you can do regressions of it using chairs. A tall chair is a good thing to start off on. And thank you for the kind words, Chris. I really appreciate that in your comment above. means a lot, and the gratitude that students show really mean a lot to me. So thank you. Okay, I think we're getting into the last question here, and then we'll wrap things up. So the last one is from Jimmy. It says, when we are doing the front anchor, and I mentioned to Kaylee before that this is about the push away. So when we're doing the front anchor and alternating our legs and raising our head, I'm kind of confused when the video says to push away. Does it mean push towards the floor or push away from the floor? That might be confusing what I said, but I struggle when I'm in the position and getting my legs off the floor. Just want to make sure I'm doing everything correctly. And he says, thank you. So thank you, Jimmy, for asking. It's really good to get clarity on this. The push away is quite confusing. It's the one concept I've had the hardest time communicating what it actually is. And so it's common that people have a little confusion around what does push away mean. And so the two kind of alternative, there's different ways to conceptualize this in your mind. And so the two different ways that I like to recommend are, one, pushing the floor away from you. So if I'm laying on the floor and I have my front anchor here connected to the floor, I would be pushing the floor away from my body with my front anchor. And so you're basically trying to get the floor farther away from you. So that could be the push away in sitting too. So I'm sitting and like I'm slouching, and then my seat is the floor, or my seat is the surface that I'm pushing away from. I want my seat to be farther away from my body, and my push away points are my sit bones. So the seat is farther away and my posture automatically corrects. I don't have to control how that happens or what muscles I'm using to do it. All those muscles work synergistically together automatically to do the thing. And the thing is to get the seat farther away from me. That's one way to look at it, Jimmy. And the other way to look at it is that you are pushing yourself away from the floor. And so the first one is you're pushing the floor away from you, and the other one is you are pushing yourself away from the floor. And that's really what's happening because the floor doesn't move. But so the exact same result happens, but I'm trying to get my body farther away from the floor. And the push away points or push away zones are the areas that I'm using to do the pushing. And I'm not concerned with what muscles I'm using, and it's not an intense thing. It's a very low intensity thing. It's the same level of intensity that a baby or an infant would use to do it, because that's how they are training their deep core muscles. And a baby or an infant has incredibly strong deep core muscles. Their spine is very supported, and they can lift their legs up and their butt up off the floor, and they're using these same push away zones that we use in the program. The program is modeled after natural human development, and a baby's intention is to get up off the floor. That's all. They have the most pure intention possible because their mind is so blank. They have a blank slate coming into this world, and they see these adults walking around and these big people walking around, and they want to copy us. They want to get up off the floor and be like us. And so their arms and legs are not strong to do that. They don't use their arms and legs yet. Before their arms and legs become strong, they are pushing away from their anchors. And they're not anchors at that point yet. They're baby support zones, and that's the bottom of the rib cage and the lower back. And when their baby's doing belly time, it's the bottom of the rib cage in the front or the pubic bone, and they're just trying to look, maybe they're not even trying to get up yet, they're just trying to look around. And this is how we develop, and the deep core muscles this is why it's so important that the deep core muscles develop first and then the arms and legs. And so in the that I know the question was just about the push away, when I'm expanding this way beyond that, but our movement patterns become more arm and leg dominant at some point in our lives. And so the goal is to switch back to how we were meant to be, which was core dominance, and the arms and legs are appendages of this big, strong center, our center of power, our powerhouse. And so that's all we're doing. It's more simple than what a lot of people have trouble. The questions that people ask are more complicated, and they're complicating what it is, and it's really just, it's so simple that it's what a baby's doing. We are using our push away zones to push the floor away or to push ourselves up off the floor, and that's it. And we're not trying to control how that happens or what muscles are doing what or what their names are or anything like that. So just turn down the intensity. If it's hard getting your legs off the floor, that's okay. It might be something like your hip flexors being really tight, and that it's not physically, mechanically possible. But we're also addressing the hip flexor length by doing the bridge. And so over time, you'll gradually get better at this, Jimmy. And it's okay that if you need to slow down in the program and not move forward, because it's going to take a little bit longer time to get to where you feel ready to go to the next module. So hopefully that helps. See a couple more comments. Sherry showing up, glad to see you here. Really enjoying your live streams. Thank you for your insights and all your help. Thank you, Sherry, for being here. I really appreciate it. And congratulations on your marriage. Have a fun trip. Thank you, Sherry. That means a lot, and we will. We're going to, I'll be working from Costa Rica, and when I'm not working, we're going to be trying to surf and enjoy our time together. So thank you, guys. Thank you, everyone, for being here. That was the last question. A little mini conclusion would be about the mind-body connection. To be aware that there may be an emotional or psychological component to back pain, and to reflect on yourself and your current situation in life, your relationships with other people or with yourself, and consider ways that you could express emotion and get it out through the form of emotion or communication, and so that it does not have to manifest in a physical way. And maybe that could be a factor for you. I don't know, but I believe it is for some people. I think it has been for me in the past. I remember feeling my back pain get worse when I'm really late for something and I'm in a rush and I'm all super tense feeling late, and my hip flexors get really tight, and I remember going, many times I remember going, yeah, my back pain's a little worse right now. And I didn't do anything except feel stressed out that I'm late. So maybe taking a breath and saying everything's going to be okay, or whatever, just having the awareness that there could be a correlation or causation or a contributing factor of the mental emotional side. The mind-body connection is real, and that's not the only solution. That maybe there is also a physical component, and so to address both is the best way to look at the whole picture from a holistic perspective. So that's the conclusion. Guillermo says, marriage? Congrats and good luck. Thank you, Guillermo. We got married back in March, and our yeah, our wedding was in March. Our official wedding marriage date is actually in April because we did the paperwork late. But um, yeah, so if you look it up in the records, we got married in April, but our wedding was in March, and we're doing our honeymoon now. So thank you guys. Thank you for all the kind words. Thank you for being here. Super grateful to be able to do this and help people for my life and lifestyle. And as you leave the stream and go back to your normal life, whatever you're doing, do something that's good for your body. Go for a walk, get down on the floor and connect to your core, or do something that makes you feel happy and reduces your stress, um, because your body does so much for you. So give something back to it, and show gratitude to your body by paying it back. So thank you guys again for being here, and next time I see you, I will be in the Pura Vida country of Costa Rica. All right, signing off, everyone. Take care, and take care of your body too. Bye-bye.